I'm Ed Fisher, and I'm a professor in the School of Public Health and have been working with Peers for Progress for the last 10 years, and am pleased to see it being of value to the university as we're all dealing with the COVID crisis. This is the first of our peer support volunteer training webinars, and we're really pleased that those who've volunteered to be peer supporters have come forward and are participating in this training. I think it would be useful for us to do what we like to call lightning introductions, just who you are and what part of the school or the university you represent very quickly. So let me call on my colleagues, Pat Tang and Samantha Liu, to start us off with that.
Hi, I'm Samantha Liu. I'm a staff member with Peers for Progress.
Hi everyone, I'm Patrick Tang. I'm a program manager at Peers for Progress.
Emma.
Hi everyone, my name's Emma. I'm a graduating undergraduate senior, and I've worked with Peers for Progress for the past year, kind of to provide student representation.
And Joanna Kwong, Jo Kwong.
Hi, yeah, I met a bunch of you yesterday, but I'm Jo, and I'm one of the incoming senior advisors in student government.
And Hannah Barker.
Hi, I'm Hannah. I'm a first-year MPH student in health behavior and an RA at Peers for Progress.
And Gray Rogers.
Hey, I am a second-year soon-to-be graduate of Masters in Health Behavior, and just now finishing Ed's peer support class.
And Sophia Bartels.
Hi, I'm Sophia. I'm a first year in the MSPH to PhD program in health behavior.
Great. And Suzanne Barber.
Hi, I'm Suzanne Barber. I'm the Dean of the Graduate School.
Great. Is there anybody I missed?
Ellie Munson.
Hey.
Oh,
thanks,
I'm sorry.
No worries. I'm Allie. I am a project manager for Dr. Golan in the Department of Health Behavior.
Great. So, welcome to this. I wanted to mention that we will circulate the slides shortly after the presentation, so there's no need for you to scribble down details from the slides. They'll be available to you. So our agenda is to spend about just a few minutes on overview of peer support activities that are emerging at UNC around COVID, talk about roles and responsibilities of peer supporters. Then we'll have a breakout group, and we'll have breakouts for each of the major topics that we have. Then challenges created by COVID, how people are experiencing the many ways that COVID is affecting their lives, how to support friends and colleagues. We'll talk about specific problems and difficult situations that people might encounter as peer support volunteers, and we'll close with a review of resources and discussion. So as an overview, our aim is to foster a culture of support, and the vision really is quite specific, that nobody feels they have nobody to turn to. We're not expecting everybody to be spending an hour and a half twice a week in support groups, but we do want to create an environment where people feel they have folks they can turn to. A very general model of what we're proposing or what we're promoting starts at the bottom with support pods, as we're calling them, and other groups. There are lots of existing groups that people get support through, so we don't need to be exclusive. We want to be inclusive. pod reps, representatives of those groups who get together and talk about concerns, common approaches, bright ideas. And then what we're initiating with this today are peer support volunteers who would be able to work as individuals with the support pods and the pod reps to expand the scope of peer support available to people. A couple of key strategies to note. First, no reinvented wheels. As I mentioned, there are lots of support groups and activities out there. Our objective is to supplement and grow, not to replace. These things have to be tailored within administrative units, schools, departments, or other units. There's no one size fits all. And an important thing here is that we're focusing on stress and distress as common experiences. We're all dealing with stress related to COVID and in one way or another. And so we're not talking people who are, or we're not limiting our focus to people who are having real clinical concerns, but the broad stress and distress that affects us all. Objectives of the training are to help you learn how you can promote peer support throughout your networks and groups and colleagues, understand what your role entails, and feel empowered by the end of this to go forth and support your friends and colleagues. In terms of roles and responsibilities, what peer support volunteers do, first and foremost, is to be available, perhaps similar to those who've completed mental health first aid or safe zone training. Reaching out to those who may be isolated. I think this is especially important amidst COVID, where people are at risk of being isolated, and trying to look around and see who might appreciate a phone call or a text is important. Work with the pod reps to organize activities and other resources. Help individuals navigate available resources. There's a lot of, we've all received dozens of emails with resources, but working our way through them is a bit of a challenge. Represent and advocate within departments or school leadership for the needs of people that you're interacting with. Refer individuals to resources as may be advisable, and of course other activities. I should say that these slides and this presentation is really developed from the perspective of the Department of Health Behavior in the Gilling School. But I think folks who are outside the school can, I think, adapt to their situation. What's expected of peer support volunteers? To be available, of course, to be respectful of privacy as in any relationship, and we'll come back to that. Respect individual differences, be available as reasonable. The peer volunteer is not going to need to be spending 40 hours a week being a peer supporter, but you know, depending on the concerns that you get engaged with, there may be needs for follow-up. But we're trying to think throughout this that our model for this is what a responsible friend would do, not a model of a professional counselor. Recognize when issues are outside of your comfort zone. Turn to others as necessary in the department, student services, courses. Collaborate through periodic meetings of the peer support volunteers. And as I mentioned, a key concept here is that the peer support volunteers are friends with additional training, not mental health counselors. General strategies are to seek out and talk with individuals, problem solve with people as may be useful. A handy sort of 3-step model of problem solving is first to validate and endorse the concerns or the feelings that the individual is bringing forward, then to raise the possibility of that maybe there's something we could do about that, that's sometimes hard. People may see that have trouble seeing possibilities for change when they're feeling overwhelmed by something. And then if they're able to discuss and brainstorm alternatives. So that's a simple problem-solving model that is useful. Discuss follow-up and further contact. Rally support among the support pod or network of individuals, friends. If somebody's going through some tough times, perhaps getting others around the individual to help them is a good strategy. And advise regarding available resources. We've put together some key resources here that should be handy and at hand for folks who are involved in this. We'll be sending this out to you all as in a way that you can print it and put it in your wallet or someplace else. If there's an imminent threat to themselves or others, of course, call 911 for the National Suicide Prevention Hotline. There's the number. Campus Health has a number of resources. CAPS has a 24/7 phone line. Academic coordinators are available for students. For employees, faculty and staff, there's the ComPsych program and employee assistance program and a number for that. And if people are unsure how to handle a situation, they can contact me at that email or that phone number. So with that, I'd like to put us into two breakouts and just for a few minutes to talk about your thoughts about the roles and responsibilities, what aspects are unclear, concerns you might have, ways you'd like to change them. Those three are really just prompts for talking in the breakout about whatever you'd like regarding the roles and responsibilities as we've described them here. So at this point, I'm going to create two breakout rooms, and you'll be randomly assigned to breakouts, and we'll call you back after 5 minutes. So let's just take a couple of minutes to talk about ideas that came out of the breakout rooms. I think anybody that just wants to share a good idea or an important thought that came out of their breakout.
Our room talked about sort of outlining the boundaries of a peer support volunteer, both what we are capable of and also where we might draw the line.
Any particular boundary that you identified?
So we were discussing the line that you mentioned about us being like trained supportive friends rather than professional mental health counselors, because that line can get blurry. And so thinking about whether we would do that for somebody as a friend and not like as a job might be a good way to think about the boundary questions when they arise.
Other comments? What was somebody from the other group? Somebody who wasn't with Jo in her group?
Yeah, I think we had some questions that we'll probably address later in the conversation. The one thing that maybe we can discuss right now, because well, we talked about it in the last 10 minutes, but yeah, what the relationship is between the volunteers and the pod reps. This was Allie brought this up, and she was saying she's not a pod rep, so she doesn't know what they're exactly doing as as representatives of the pods. So that maybe knowing that would help her know her relationship to them and how she might interact with them.
So we're going to need to find ways of connecting the pod reps and the peer support volunteers, and everybody will be listed on the website so people can see who each other is, but we can also do some connecting. Okay. Let's move on to talk about challenges created by COVID-19, and Pat Tang is going to work on take us through those challenges. So Pat.
All right, thanks, Ed. Is there a way to get rid of the menu bar up there?
I think that's it.
Okay, that's okay. So some of the challenges that have kind of been created by COVID-19, we want to hear from folks about some unique experiences maybe that they've had. I think there are a lot of common experiences amongst the next couple of slides that we've either experienced ourselves or seen friends and family go through them. And this is from the perspective of our campus community. But we just want to go through some of these to make sure that people are aware of the variety of things that people are going through. Some that may be obvious and some that maybe are not as obvious. But I think the key thing for us to keep in mind is that we don't always recognize the buildup of stress, and due to changing circumstances and disruptions, we're all under stress throughout the days, and it's been an extended period of time, so that tends to build up. We don't recognize it, and often we attribute those things to problems with ourselves or with people around us, but maybe not recognizing that it's actually a result of a situation or something that's out of your control. So that's something definitely to keep in mind. Next slide, please. So some of the specific examples that people in our campus community are experiencing, this is a list that we've generated at Peers for Progress with some input from other folks. Just wanted to highlight some of the ones maybe that we don't think about on a routine basis, but I think a lot of students are facing the reality of graduating into this type of environment where, and folks who are not graduating but having to plan out their summers and having that kind of uncertainty. What is it going to look like for them on their resume, on their professional development? So that is a huge source of stress that there's, I don't think, a really good answer to right now, except for allowing people to kind of express their frustration with that. Another thing that I think we often overlook is just how much information overload people are experiencing. All the emails that you're getting from folks in the community, maybe all the newsletters of nonprofits or groups outside of school that you belong to, all the junk email you get from companies that you've bought one product from that are giving you updates on what they're doing about COVID day to day. I think there's just so much that we're getting that it's hard to focus on what the most important stuff is. One of the things that we found really interesting that people brought up was that because of kind of the routine disruption in your routines and having to stay at home, is that people often run out of things and events to look forward to. And I think that's definitely one area that peer support volunteers and support pods can help with, is to create those things to look forward to. Next slide, please. So now that we've gotten a sense, I only highlighted 3 of those, but you saw there were a lot of examples. But let's go through some of the helpful tips and skills that you can use to help people experiencing that kind of stress and distress. You know, very generally, I think the first thing is to, you know, make sure that you're taking care of yourself first. And give yourself some slack, because you know this is an additional role that you're taking on, and you know, you don't have to be an expert, you don't have to always know the right thing to say, but the point is that you are making that effort to reach out and connecting with others. In this time, I think people, this time of social isolation, I think it's really important to proactively reach out to others, especially folks maybe that you haven't heard from in a while, because people are very open to receiving a text or a call out of the blue to check in on them. Next slide, please. I think oftentimes in our rush to solve problems or to, you know, help people, we forget to take care of and ask the obvious things. So, you know, when you're just getting onto a call with somebody, definitely check in with them about their family and their loved ones. Check in with folks that are sick, you know, non-COVID sick or with COVID sick. But just asking about those things that's kind of common, instead of you know, jumping into maybe something that is a bigger problem. Next slide. And simple ways of helping people, things that we might forget. I just want to highlight a few of these on the slide. But what we've learned in our programs is that small gestures from people that you trust can mean a lot. So it doesn't necessarily, you know, it doesn't mean that a peer support volunteer needs to be on a phone call with somebody for an hour. Longer doesn't always, you know, necessarily mean that you're providing the type of support that someone's looking for. Some people, it's important for them to just get a voicemail, to get cheered up by a meme that you've shared with them, and you know, that makes it more likely for them to maybe open up with you in the future when they are experiencing distress. We do want folks to set out time in the week to make reaching out part of their daily or weekly routine. I think how much you're able to do depends on your own situation. But if we just do it when we feel like it, I think that's a less effective way of making sure that you're reaching out to folks regularly. And the last point here I just want to share is that like a phone tree, folks that you've reached out to, you can always encourage them to expand, you know, the outreach to their social circles as well. So in terms of support skills that you might be using on a regular basis, just since we can see folks, if you just show a thumbs up on the screen or something if you've done sort of training on these skills, or you've used these, or you're just generally maybe familiar with some of these skills. Can I just see a quick show of hands? All right, seeing a few people raising their hands. Okay, great. So this is something, you know, we can definitely do more trainings on these specific support skills in the future, and we can send polls out to see the types of interest in that. But these, you know, when we train peer supporters and community health workers, peer health coaches, we will definitely go through all of these support skills and take a good half day, full day just on these specifically. So there's no way we're going to cover all of that today, but just letting you all know to you know, find ways to incorporate some of these into what you're doing. And next slide, thanks. And this is kind of a repackaging of Ed's general strategies from slide 11, but a good way to keep in mind the things that you should be doing when you're actively supporting somebody. Listen to their concerns, so practice active listening there. Avoid judgment. Ask open-ended questions to encourage sharing. Ask. Notice when people are experiencing serious problems or distress. So that's oftentimes noticing changes in behavior. Notice when you haven't heard from people in a while. Follow up with them. So if you're referring them to a resource that was mentioned earlier, check in with them afterwards to see if they've gone and taken advantage of that. Refer to backup. And so this is what we're trying to build with the peer support volunteers right now. We are each other's backup, as well as Ed and Peers for Progress. So if you want a second opinion, you want to check in on something, refer to us. And just remember that one of the key things is just being there for somebody, and that means being available and reliable. And that's probably more powerful than any specific thing that you can say to them or problem that you can solve for them. All right, next slide. So we'll go into another breakout session here. Ed, if you can help us set another one up.
Mm-hmm.
And some of the questions maybe coming out of this section, in your experience, what are the stressors that have come up the most for you? How have you been helpful, or do you think you can be helpful with those? And what are the strategies that you've seen that are appropriate? But those are just to start you off. You're obviously free to discuss whatever you like, the questions that have come up during the last section.
Let me ask, put a couple of people on the spot. Sophia, could you tell us a little bit about what you all discussed and what you thought was helpful? Sophia Bartels.
Hi, sorry, my internet connection was out for a little bit, so I might not be the best person to summarize.
How about you, Allie? How about what went on in your group?
Sure. I'll turn my video on for that. So my group, a couple folks shared actually about just kind of working into their daily routine or weekly routine, reaching out to friends or acquaintances, anyone that they've interacted with, have WhatsApp messages with in the past, and kind of just sending out like, how are you, or general messages to people, including the voice recordings that you can leave for people on WhatsApp. And then we also talked about how in Zoom and doing meetings from home, there becomes a lot of natural, more sharing of personal and home experiences, which can be a good way to connect with people and share more outside of the professional experiences than in the past.
Great. Mm-hmm. Anybody from the other group want to talk about what you all shared? Don't be bashful.
We had a question to bring back to the big group, which was to,
Sure.
We mentioned this briefly, but how to approach people in a way that sounds empathetic and doesn't, I guess, like come across condescending or patronizing in a way that's like, here, let me help you. But yeah, we were thinking about how to do that.
So what do people think about that? The first contact is the hardest.
So we talked about your point about just sometimes, or the point about thinking or asking about the simple things. That doesn't imply anything, and it just sounds like you're checking in, and that kind of opens up an avenue for them to share, like, should they want to.
Other thoughts on that?
I think maybe also saying, like, starting like as a fellow student, or talking about how you're worried about or want to check in on the UNC community in general, so people don't feel singled out, but they feel like they're maybe more part of the community and you're just trying to make sure that they have the support that they need.
Yeah.
Yeah, I think maybe part of it is also how you got connected. So if there was maybe a referral from somebody else, like, oh yeah, there's somebody that's wants somebody to talk to, could you reach out to them? That's quite different from someone maybe a looser acquaintance that you've noticed, maybe a change, and you're actively reaching out to them without a kind of a prior acknowledgement that they were going to be contacted. So that cold contact, I think it is challenging. Yeah.
I do think that in these times, people are more open to people sort of taking the initiative this way, because we all realize how isolated we are. So I think for, obviously not a total stranger, but for a number of your colleagues, fellow students, friends, it may be okay to say, hey, I just hadn't heard from you for a while and was wanting to check in, see how you're doing. I don't think too many of us are taking offense at that these days. But obviously, as with all of this, the key is judgment and knowing your relationship with other people and what feels comfortable and right within that. Any other comments from the breakouts before we move on?
Just one thing, not so much related to the breakout, but the slides. There's a slide that talks about stressors, and it has school stressors, for example. I think the term work stressors probably ought to be on that slide too.
Okay.
To make it
Thank
more
you.
inclusive, only because I would like to think that this training would apply not just to students, but to faculty and staff as well.
Yes, thank you. Yeah, we would have liked to have spent more time on that slide, just getting folks' input on stressors they're experiencing, because it's a never-ending list. But definitely, we want this to be a community-wide set of resources and activities, not just for students.
Thank you.
Yeah, Suzanne, this is Melissa Halstead. I'm in HR, but I saw the notice come across, and I told my first group that I spoke with that, I just found the topic and the agenda very interesting, and that it could provide me help, not only in my role as an HR consultant, but also when our team talks. Our team, we get together once a week for a call with everyone, but my team lead has also implemented a call with her team, just the smaller group of us, about half of the entire team.
That's
so we
great.
just, talk in general, how are you doing? What's going on? And then we all bounce things off of each other, and they actually helped me yesterday with a plan. My granddaughter's been staying with me, and helping her with schoolwork has been quite a challenge, more than I really thought it would be, and being able to do my job. So I've got several different plans. If this doesn't work, I'm going to try this. So it was just so helpful to get their input. Some have been through it, some haven't, but it was really worthwhile. Communication is really the key. Thank you.
Well, and I think what you illustrate there also, Melissa, is the complementarity of support from individuals like peer supporters, but also support from our groups and those around us. And kudos to, I think you said it was your supervisor, for saying, hey, let's have a smaller group that gets together here and shares ideas.
Yeah, smaller group.
Well, I'm going to move us along to the next topic, um, which is problems and difficult situations you may encounter. And so situations you might encounter are individuals in academic or job jeopardy, and individuals dealing with serious disease or death of a family member or a close friend, individuals unable to financial demands, individuals unsure of resources available, or individuals withdrawn or unable to pursue daily activities and responsibilities. So, you know, we want the work of the peer support volunteers and the pods, the other groups, to be positive and encouraging, but we need to be prepared for the fact that some people are going to be encountering really difficult times through the next months. So we put together this list, and we got help from Charlotta Sims Evans, who's the Senior Dean for Student Affairs in the Gilling School, on this. So if you have an individual who's seriously, persistently, or acutely distressed, hopeless, unable to complete tasks, either all of a sudden they're really at their wits' end, or there's a problem that they've been dealing with for a while and it just isn't getting any better, and they're
I think is Ed's connection not so good? Can other folks hear me?
Can hear you, yeah, but I lost Ed.
Okay, I think Ed might have froze there. Spotty internet connection. That's definitely a stressor these days.
I think there's storms coming through. That might be part of it.
Oh, is it? Hasn't hit us here in Durham quite yet. All right. So let's. I'll put up my screen here. Are people seeing the presentation view for that?
Yes.
Yes.
Okay. So yeah, continuing off of where Ed left off here, I think the important thing to remember on this slide is to use good judgment, and you know, when you're going to contact other people on somebody's behalf, it's you can always ask somebody. Or let them know that you plan to take that kind of some sort of action. You know, people will definitely you know, respond positively if they feel like you're advocating on their behalf, or doing something that maybe because it's part of your role or part of something that you're comfortable doing. Let's hold on one sec. Yeah, to use judgment when advocating on somebody's behalf, and you can always do that confidentially. So you don't need to identify a person when you're going to folks for a second opinion or contacting some type of leadership or a service, and maybe whatever you come back, information you come back with. Will encourage that person to maybe follow up with a service. And I think a key thing to remember is this is very similar to what you might do for any colleague or a friend. You know, the key thing is that you feel comfortable making that referral to one of these professional services. And as before, we are here and available if you have something that you're not sure about. So we wanted to have just our last breakout discussion and talking about some of these situations that you might encounter, maybe what makes you uncomfortable, and about some of these, and how you might think about dealing with them. So in our breakout groups, actually, I don't know if, let's see if I'm the official host, because only the host can create breakout groups. Let's see. Okay, yeah, I can create a breakout room here. So if somebody in the group can put up the slide about situations that peers might encounter, and maybe if people can talk through if some of these make them feel uncomfortable, or if they feel like they feel like they can address those and know how to, we can have a short discussion on those. All right.
If we have a minute, any comments from the breakout rooms?
Yeah, in our room, Melissa brought up a good point, that hoping that there's some way to connect folks with unique experiences. So she was sharing that you know, some grief and loss that she had, but how can peer support volunteers you know, make themselves available to others who have gone through some type of loss during this time. And you know, I mentioned that, you know, we can definitely create some sort of profile or short description of the volunteers' problems that they are able to work on, you know, shared experience, lived experiences that they might have, and that would be a useful information for folks that are trying to do some matching, or for them to make connections.
Yeah, so the peer support volunteers could refer to each other.
Mm-hmm.
Yeah, I was just saying that it's sometimes, depending on the situation, it's good to know that, you know, somebody else has been through this same rare
Sure.
thing during this rare time that we're in.
Right. Any other? So we raised in that last section, you know, what is perhaps most challenging to becoming a peer support volunteer. In general, are folks comfortable with that? Do you feel like you've gotten good resources that you can deal with, could deal with things?
Personally, I still find it very daunting, but I also kind of acknowledge that this might be something that you learn as you go.
Mm-hmm.
So just keeping an open mind to the resources that they're there if I need them, but also the role of the peer support volunteers is to just offer that support and not fix these problems. So,
Right.
yeah.
So back to you, Pat.
Thanks, everyone. I will get my screen back up here. And I will hand it over to Samantha.
Thanks. Can you go to the next slide, please? So y'all have already seen these resources. They're the same ones that Ed showed earlier in the middle of the slides. But next, just remember that ultimately you are the best resource, and that you don't need to have a pulse on all of these resources at once. You don't need to have all these phone numbers and websites memorized. You just need to be available and willing to help someone look for these resources and to know how to find some of them. So I'm going to show you some resources. Don't feel like you have to screenshot them or write them down, because we will share the slides. Next. So first is just some general good background information on COVID-19 related information. Here's some good, credible, up-to-date sites. Next. There's a whole lot that UNC is already putting out there for students, faculty, and staff, and these are some of them, including the Gillings information portal. These are both informational sites, but also different resources that might be useful to you as you're talking with someone. Suzanne, Barbara, I'm seeing that you raised your hand. Do you have a comment?
Yeah, I was just going to add a link to the graduate school's coronavirus site, which has a lot of information for graduate students. I'll send that and drop it. I'll drop it in the chat.
Okay, wonderful. Thank you. Next. This last slide has a list of different resources for tangible assistance. I know in one of the groups we talked about instrumental support, and this might be something useful if you're working with someone who might need access to different resources because of changing job situations, academic situations, and such. I do want to highlight 211 resource navigation is quite robust, especially here in North Carolina, but it's available nationally. So if you're talking to someone there who could use that resource. I've also put in the Carolina Student Impact Fund, which is generally for the entire university for students, though I know that there is one that's forming in Gillings, which is the link next to it. And then I believe that there's also a graduate student one specific. And next. So we talked about a lot of different skills. We talked about some resources. And so what do you all do with that now? And what can you do this afternoon to be taking some first steps? Some ideas for you are listed here. I think some really important ones are for you to confirm your willingness still, that you want to be listed as a peer support volunteer. Pat, myself, Ed, we're all happy to speak with you if you find it helpful in making that decision now that you've gone through the training. The second thing you could be doing is contacting pod reps or an appropriate pod to let them know that you're available to talk to them or individuals and to plan out what your interaction with that pod rep might look like. Every situation will be a little bit unique. The pods that we have listed so far are on the Peers for Progress website. We'll have a link for that in a second. But see which pod is most appropriate that you might be working with, but also if there's one that's not on there, your cohort's not there, or maybe your lab isn't there, think about whether or not you want to step forward as a pod rep and pull everyone together and register your pod. That might be helpful for other people who might be looking for a pod as well. Sending an email to those who you want to be available to is another idea, teaming up with each other, and then sharing additional resources. So Team Barbara, you just posted that link for us, which is great. If anyone else has any other links you want to make sure that we get into this PowerPoint when we share it, please email me. My email's at the bottom, and we can make sure we do that if you get it up to me, let's say like maybe the end of the day tomorrow. Next one. You've also got the rest of our emails here. The slides will be available at that website URL at the bottom that Pat is pointing to. And then want to close today with some time for additional questions and discussion. But the first question that we have is one that Gray brought up earlier, which is how will peer support volunteers be connected to each other? I think that that is up to you all as volunteers, that you can decide, do you want to have email listserv, a group chat, anything like that? What are your preferences as volunteers? Any thoughts on that?
I like the listserv idea, and I think I heard mention of a team site somewhere. That might be helpful to post and share resources.
Everyone else good with Teams or a listserv? Let's see, Gray in the chat says, I would like a group chat with other graduate student peer support volunteers. Okay. Great. So if anyone else has any comments on how we want to be connected with each other after this, you can also send those to me via email. But would like to make sure that you all have the opportunity to ask any lingering questions after this last hour.
I had one that I wanted to pose to the group. At the beginning, folks talked about the issue of being a friend versus being a counselor and how to interpret that and make sense of that for yourselves. How do you all feel about that at this point? Joe, you were the person who brought that up.
Yeah, I feel a lot better. I think I got some clarification throughout the rest of the presentation about more concrete ways that we can approach people, or things we can offer. And also, it is absolutely true that nobody right now is going to really object to being checked in upon.
Oh, really? You stated that strongly. Absolutely true.
Well, I think so. I mean, I've appreciated it. I guess, okay, I should qualify.
No. I'm not meaning to challenge you. I think that's really important.
Yeah, I mean, the people who have checked in on me and the people who I have checked in on have all like expressed appreciation, and I've definitely felt very grateful that people thought of me. So this is creating that environment where checking in is becoming a norm.
That's a nice way of putting it. Checking in as a norm. I think it'd be really helpful if others who have thoughts on that could add them.
I think I have the same idea that I don't think that anyone would be very opposed to getting a message. I think I've struggled with knowing who exactly to reach out to, because at least in my pod, I don't think there's been any like outward inquiries for support. And then I could go in and sort of message people that I've not heard from in a while, but that's sort of the nature of the group chat, is that some people are much louder and some people are just not very that won't frequently message something, but maybe they'll like other people's messages. So I've been trying to think about maybe if I should speak to the pod rep about that and sort of strategize who I should reach out to. And then it was also just the phrasing of the message of, haven't heard from you in a while, but then I maybe have never heard from them. So
right.
It would sound kind of weird to say that. So that, I think, those like little details of what I've been thinking about.
But I think taking Joe's point, Hannah, even somebody that you'd never heard from, you could say, I hope you don't mind my getting in touch with you this way, but I'm just trying to think about folks in our group and make sure that just trying to reach out to folks and say hello and see how folks are doing.
Yeah.
I think that's why I was so struck by the way Joe said that. It seems to me that maybe that would be okay for most folks.
That's true. That does sort of simplify it a little bit. And
How do others feel about that?
Hey, Hannah. Also thinking about like just sort of the group me that we have for our cohort and that not really being a norm. I think maybe even considering like a separate group me or a way that folks can contact you more directly so that not everybody sees through the group. Or just thinking if your group me is kind of for our similar to our purpose of just, you know, more academic updates and that sort of thing. You know, I think to provide that foundation to give peer support, I think there has to be a channel for that support to come through. And that's yeah, I think maybe something you and Eduardo, I think is your pod rep, like can talk about.
yeah, that's a good point. I was, imagining individually messaging people on GroupMe separate from like our group chat because it doesn't list phone numbers, but yeah, emails are another way, and so there's different options that I can explore.
And I would say that folks, one thing to remember is folks want different types of support and gravitate towards different things. So there are people that just like to lurk and they will read everything that gets posted, but they'll never contribute something to that group chat. So, I mean, posting is something that volunteers can do to promote peer support, even without that kind of asking someone to, you know, about how they're doing. Just making sure that it's an active group chat or forum is a service in and of itself.
There was a question, Gray, that you posed of how you can provide feedback to us and if there's going to be an evaluation that you can support as volunteers. We've been collecting feedback verbally and via email at this time from different stakeholders, faculty, staff, students, admin, pod reps, as we've gone along with different calls that we've had with each group. So I think it's mostly been via email or verbally for now, but I can definitely share a link to an online form when we have one. But for now, if you have feedback, we're happy to get that via email.
And on that, we would really appreciate right now if people have suggestions for things we didn't cover that you wish we had, or things that we might include in future trainings or future, you know, webinars about being a peer support volunteer. We're anticipating that we can have more webinars in the future to talk about specific topics that folks want to learn more about.
This is Allie again. I had one thing, and I think as a staff member, some more peer support tactics for other staff members or for like leading a team would be helpful. I know I run meetings for small teams, and you know, we try to check in at the beginning, just do a general check-in on how everyone's going. But you know, I've been thinking about recently, like, what are some good prompts that I could use to create a safe space to get people to be able to share and support each other, or whether it makes sense to do kind of like separate work meetings, as well as just general, like more COVID-19 check-in related meetings with same people. So any resources or, presentations you all had in that regard would be really helpful for me as a staff member.
That's helpful. I know there's a junior faculty pod. I should say that's their name. I would have called them early career faculty. But there's a junior faculty pod in health behavior, and they've told us that they're just talking about informal stuff and taking the opportunity to talk not about careers and not about work. So I think your sense, Ali, that maybe having an opportunity for just non-task oriented conversation is important. Gray, you raised the question of providing feedback. Is there anything you would suggest that we deal with in future versions of this, or future opportunities for more advanced discussions and presentations?
No, I guess feedback wasn't exactly the right word, but I think just, I guess just sort of what comes out of this and the type of support we're able to give,
Right.
feedback more in that sense. But I think something, I guess just thinking about kind of going back to the group me, that sort of issue, just thinking of, I think it would be a great opportunity to like have peer support volunteers or students connect with other students and other, on other channels if possible, just knowing, just because there are certain social dynamics and things within cohorts, and since people are closer, there may not be, there may be some hesitancy to share, thinking that it would come back to the group, if that makes sense.
Well, and I was thinking a few minutes ago, there's nothing to keep you all from starting in groups of your own if you're interested,
Yeah.
It could, I don't know, maybe there's a way to play bridge by Zoom. I have no idea. I don't know how to play bridge without Zoom. But please consider yourself empowered to do anything like that. And you do raise a good point. We will definitely follow up with you in probably a fairly open-ended format, asking you how this has been valuable or helpful, and ways in which you've been able to feel that you were contributing to the overall body of support. And I think sharing those responses with everybody will be very useful for everybody else, that we can all learn from each other. So that'll be sort of, if you will, both an evaluation and a continuous quality improvement strategy at the same time. Other general comments or questions?
Team Barber in the chat also, I think, had another topic that we could discuss in the future around cultural sensitivity and how these approaches could transcend or fit with different cultural norms.
I think that's a really important one for us. Other topics for future sessions? Please use the thumbs up utility. If would you be interested in future webinars to talk more about how people can be helpful as peer support volunteers. Saw a couple of hands go up. Okay.
I'm going to stop share just so it's easier for people to see each other.
Yeah. So, Pat, Samantha, what else do we need to cover?
I don't have anything on my end, but just, yeah, wanted to thank everyone for joining us today, and I hope you felt this was useful to you, and that you feel comfortable going out and being supportive to people in your social networks.
Thanks for joining us. We'll have these slides posted soon so that you can have all of the notes.
And to those of you who are in the school, we'll be in touch to confirm your agreement that we list you on the website as now an official peer support an official but friendly peer support volunteer.
Thank you.
Thank you.
Thank you, everybody. Stay well, stay happy, stay safe, and we appreciate your involvement today, and we'll look forward to being in touch in the future.
Thanks so much. Thanks.
Thank
Thank
you.
you.
Thank you.
Bye, everyone.
Bye now.
Bye-bye. Bye.